Retatrutide. You may have seen or heard about Eli Lilly's newest drug before, and I wouldn't be surprised if you did. It's gotten significant attention in the medical field for triple-acting benefits. This once-weekly injection is showing average weight loss approaching bariatric surgery territory in late-stage trials by combining 3 hormone pathways instead of 1. But how? Today, I'll explain to you how Retatrutide works, what existing clinical trial data shows, and the future promise of Eli's newest and hottest drug, so you have a better understanding of weight-reducing drugs like these. Now, I'm going to start by explaining for those who don't know what Retatrutide is. Retatrutide is an investigational once-weekly injectable peptide from Eli Lilly. According to Lilly and PMC, it activates 3 distinct metabolic hormone receptors, GIP, GLP-1, and glucagon. GLP-1 acts as the body's appetite suppressant by suppressing hunger, slowing digestion, and triggering insulin release to keep blood sugar in check. GIP works alongside it, boosting insulin while regulating fat metabolism and notably quieting the nausea centers in the brain that GLP-1 would otherwise aggravate. Glucagon plays a different role entirely. When elevated alongside the other 2, glucagon shifts into fat-burning mode, increasing resting energy expenditure and breaking down stored fat, particularly in the liver, without causing dangerous blood sugar swings because GLP-1 and GIP are keeping that balanced. To understand why this drug breaks current weight loss ceilings, we can look at the role of each hormone pathway it targets. What exactly does each hormone pathway contribute to a triple agonist? GLP-1 receptor agonism reduces appetite via central brain signaling, slows gastric emptying, and increases glucose-dependent insulin secretion. Reviews in PMC show GIP receptor agonism complements GLP-1 by influencing adipose tissue metabolism and improving tolerability. The crucial differentiator in Retatrutide's design is the addition of glucagon receptor agonism, which fundamentally changes how the body handles stored energy. In a natural state, glucagon acts as your body's low blood sugar alarm, signaling the liver to release stored sugars into the bloodstream, a process known as hepatic glucose output. In isolation, this spike in blood sugar would normally be counterproductive and risky for someone with type 2 diabetes or insulin resistance. However, leveraging glucagon in a multi-agonist design unlocks powerful metabolic benefit. It acts like an internal thermostat, continuously increasing resting energy expenditure, so the body burns significantly more calories, even while at rest. It also aggressively promotes lipolysis, a molecular process that breaks down your body's fat. This effectively forces the body to actively dismantle stored body fat for fuel, rather than simply relying on the passive calorie deficit created by a reduced appetite. Crucially, this intense fat-burning mechanism excels at clearing out ectopic fat stored deep inside the liver, offering massive potential for patients with metabolic liver conditions. Because increasing hepatic glucose output is inherently risky on its own, the brilliance of this multi-receptor approach lies in the counterbalance. The GLP-1 and GIP components stimulate enough insulin production and slow digestion just enough to completely neutralize the potential glycemic risks of the glucagon. They keep blood sugar stable and safe, allowing glucagon's fat-burning and energy expenditure benefits to run unimpeded. However, adding a third biological pathway does not guarantee superior results for every patient. However, you should keep in mind that questions and concerns about safety are still present, especially around this potent glucagon component and its tendency to increase resting heart rate. That said, substantial progress has been made to address these concerns given the phase trials the drug has completed. I'll explain these completed and ongoing trials to you shortly. The New England Journal of Medicine published the Phase 2 randomized placebo-controlled trial in 2023. Researchers tested multiple doses using once-weekly injections and gradual dose escalation to measure % weight change. By 48 weeks, the highest dose 12 mg group achieved roughly 24% mean weight loss, compared to just 2% on placebo. A massive proportion of patients achieved clinically meaningful thresholds of 10 or 15% weight reduction, and weight trajectories suggested continued loss if the trial had extended. Safety data revealed dose-related gastrointestinal adverse events, nausea, vomiting, and diarrhea, alongside observable resting heart rate increases. However, as you probably already know, a 48-week Phase 2 trial cannot definitively prove long-term cardiovascular safety, durability after cessation, or real-world adherence, to answer these remaining questions and satisfy regulators. Eli Lilly launched a massive Phase 3 clinical program to test the drug across diverse patient populations. They launched Triumph, a massive Phase 3 clinical program evaluating Retatrutide across obesity, metabolic complications, and type 2 diabetes. Triumph 1 serves as the pivotal Phase 3 obesity anchor trial. Publicly registered, it measures weight change and categorical responder endpoints over 80 weeks. Multiple Phase 3 trials are necessary because obesity is highly dependent on other health factors. So as a result, regulators and clinicians require specific data on subgroups managing osteoarthritis pain, sleep apnea, and cardiovascular risk. Evaluating these trials requires looking beyond average weight change. We must analyze categorical responder endpoints, like the percentage losing 20 or 30% of body weight, and discontinuations due to adverse events. These trials also track cardiometabolic markers, including waist circumference, blood pressure, lipid profiles, and inflammatory markers to verify systemic health improvements. Now, the initial top-line reports from these Phase 3 trials have now provided a clearer picture of the drug's maximum efficacy. The Triumph 1 results reported by Eli Lilly and covered by major clinical news outlets show that the efficacy at roughly 80 weeks is unprecedented. Participants on the 12 mg dose achieved a 28.3% mean weight loss. The 9 mg and 4 mg groups saw 25.9% and 19.0% reductions, respectively, against a 2.2% placebo baseline. For reference, an average loss approaching 30% overlaps historically with clinically measured weight loss procedures. Yet, substantial proportions of high-dose patients surpass this 30% total weight loss. Beyond the scale, reported data show robust improvements in cardiometabolic risk factors like waist circumference, blood pressure, lipids, and high-sensitivity C-reactive protein. However, class-typical gastrointestinal adverse events and trial discontinuations are still issues some patients face. Despite the record-breaking efficacy numbers, massive trial averages never guarantee seamless success in the real world. Tolerability remains the ultimate efficacy limiter. As noted in GoodRx and the NEJM Phase 2 data, gastrointestinal side effects like nausea, vomiting, and diarrhea frequently forced dose reductions or complete discontinuation in some patients. In addition, resting heart rates in some patients increased due to their doses, which raise serious concerns about cardiometabolic health. These concerns require patients to do longer-term follow-ups to ensure there are not significant effects to one's cardiovascular health. It's also important to understand that rapid weight loss also causes lean muscle mass depletion, making resistance training and adequate protein intake mandatory. Additionally, the trial populations used exclude pregnant women and complex, frail, elderly patients, meaning real-world benefit-risk profiles will vary. And for the time being, Retatrutide remains strictly investigational and unapproved by the FDA. But it's possible to see these Phase 3 trials complete soon. That said, there are multiple milestones to hit after Phase 3 trials before this drug reaches pharmacies. The most critical impending evidence includes full peer-reviewed Phase 3 publications, detailing subgroup analyses, longer follow-up for safety, and dedicated cardiovascular outcomes trials measuring hard events instead of just risk markers. Clinicians, payers, and patients are heavily focused on the pending head-to-head trial against tirzepatide to quantify the exact efficacy versus tolerability trade-off. Eli Lilly's indication expansion strategy relies on proving Retatrutide resolves obesity complications like osteoarthritis pain, sleep apnea, and cardiometabolic risk, which is required for broad medical acceptance and insurance coverage. Until regulators review these final trials, Retatrutide remains an investigational molecule. In the end, it is a matter of time before the fate of this drug becomes clearer. But when that time comes, now you'll understand what this could mean for you or your loved ones. So the key takeaway is to treat Retatrutide as a high potential but still investigational option, and to watch for full Phase 3 publications and outcomes trial results that will clarify exactly who benefits most and at what physiological cost. With that, thank you for watching and stay healthy.